So, Dr. Heather Morreale, welcome to PedChat. And you've been working in pediatric primary care for about 5 years post-residency, I think.
Yep. Yep.
And you've been doing so while dealing with a very painful post-herpetic neuralgia. I probably butchered that. And apparently, from what I've heard from you, this is a very painful disorder or disease, and it causes a lot of people to quit working. Can you tell the audience a little bit about the disease or disorder for those that don't know, and what has pushed you through continuing to practice and continuing to help children flourish?
So it started about 7 months ago, and it comes from getting shingles. So when you're a child and you have chickenpox, I had chickenpox when I was 6 months old because they didn't have a vaccination when I was a kid. And then the virus lays dormant in your spine. And then when different things happen, it comes out as shingles as an adult. So I got shingles in November, but I never got a rash. So it was quite difficult to diagnose. I just have kind of like a stabbing pain, kind of like I'm getting a spear in my rib cage. That's what it feels like. It's not all the time, but it's a lot of the time. And is when the nerves get damaged by that chickenpox virus when it gets reactivated. So actually now with chickenpox vaccination and now a shingles vaccination, hopefully, this problem that I have can be avoided by a lot of people.
And what has kept you moving through the pain? Do you just love working with children, love working in pediatrics, or what's kept you moving?
Well, so I actually read an article recently, it was on Medium, and it was about different kinds of happiness. And they say there's one kind of happiness, which is hedonic happiness, which is, from eating a good dessert or going to a dance or, the kind of like pleasurable stuff. And then there's another kind of happiness. I don't know how to pronounce it, but it was spelled something like eudaimonic happiness. And that's from being fulfilled, helping people, making a difference. And that's what working with kids gives me. So, I work Monday, Wednesday, Friday. I did reduce my hours, but it's so rewarding to help a kid, a kid who's suffering, a kid who's sick, a kid who doesn't feel well, and then I can offer something to make them feel better. Very rewarding. It's not something I want to give up.
Well, Heather, I got to say, I've been a fan of your writing for, 6 or 7 months now. What made you start writing? And why do you think that social media and writing is really important for doctors and for the future of pediatrics and medicine in general?
I think I've always liked writing. Even in high school, I really liked English and writing essays and thinking and critical thinking. And that's what writing does for you. It lets you express your thoughts in a well thought out analytical way. And in medical school, I blogged for Lancet Student, which doesn't exist anymore. But so I did some blogging then, and then kind of put it aside for most of residency, just 'cause it was too busy. And then picked it up again, first with Twitter, and then with writing for Medium, and then Facebook and blogging on my own website. And each avenue is different. My Twitter feed is partly for doctors, partly for parents and families. It's more disseminating medical information, new studies, new treatments, medical news, that kind of thing. Facebook is a little more parent-oriented, parent tips, that kind of thing. And Medium is really more, I'd say, for other doctors or other people, who care about medicine and what's happening in medicine. So I kind of like that it lets me express my thoughts to different audiences and communicate different ways.
How has communicating, let's stick with the OpMed Doximity channel on Medium. How has writing helped other doctors? Like what kind of comments have you had on your posts, and how are you helping doctors connect the dots or learn about new studies?
Well, so I guess I wrote one article about my shingles experience, how it was very hard to diagnose, and another article about how mindfulness can help doctors diagnose people with rare conditions that are presenting in unusual ways or presenting mainly with pain, things that can't be objectified on a test or an image or something like that. So I hope I kind of opened the minds a little bit of other doctors about patients who present with pain as their primary symptom. I think the medical evidence shows certain groups, when they present with pain, don't get treated the same as others: minorities, women, people with mental disabilities. Their pain can be undervalued and undertreated. Same thing for children. I mean, for decades, infants were not given pain treatment because it was thought infants didn't feel pain. I mean, that's ludicrous. So I think how we treat pain and manage pain and assess pain needs to be changed. And so as some of the posts from, ER doctors and internists and, doctors that see patients who have shingles without a rash, which is what I had, I said, wow, I never even knew this was a thing. Sometimes I suspected that's what it was, but I didn't know this was a real thing. So, when they encounter a patient that has it, they can hopefully, address it and treat it.
You mentioned, I believe in an email to me, that there's this mental health issue in primary care. And I think the issue is kids cannot find psychiatrists. And you mentioned to me that you treat depression, anxiety, ADHD, et cetera. And you feel that pediatricians need to screen children for mental illnesses and step in and treat as well as refer. Can you give the audience some more insight on how you take these extra steps to treat things like depression, anxiety, and ADHD, and why it's extremely important to screen children for mental illnesses?
Sure. So the AAP does recommend screening all children for mental health or developmental disabilities. So there's common screens that we can do that are part of the medical record. But when a child screens positive for anxiety, depression, suicidal thoughts, the critical thing is, what do you do now? And, when I was training and going through residency, I worked with a lot of different supervisors or older pediatricians, and many of them would not prescribe any of the SSRIs. They wouldn't prescribe Prozac, Zoloft, any of them. They would just refer kids to psychiatrists. And the problem is there aren't psychiatrists. So in central Massachusetts, it could be at least 3 months to find a child psychiatrist. And that's if you have, private insurance that's accepted widely. If you're on public health insurance, Medicaid, it could be even longer. And you may have to drive a long way. The appointment may be in the middle of the day when a parent can't leave work. There's huge barriers for kids finding child psychiatrists. So I did a rotation in psychiatry in medical school. I did an extra one that was optional. I've gone to some courses about pediatric psychopharmacology. I've gotten books on my own. And then actually in Massachusetts, there's a great resource called MCPAP, which is, I believe it's state funded. And if I have a child come in and they have severe anxiety to the point where they can't function and medication is clearly indicated, I can start it on my own, which most of the time I'm comfortable doing. But let's say there's some complications with the kid, there's some other stuff, I have some questions, I can actually call this number and speak with a child psychiatrist and discuss the case, and they'll give me guidance on what to do. So this MCPAP resource is really helpful in our state. They do emergency assessments, like a one-time assessment to help you out and figure out, how to take care of the kid until you can get them in with a private psychiatrist. So there's a lot of resources that are available if you can, self-learn and teach yourself and learn from others. But I think it's really important because, kids are suffering. I have on numerous occasions given the standard screening for 12 to 18-year-olds. It's a depression screening called the PHQ-9. And the last question is, do you ever have thoughts that you'd be better off dead? And I mean, I can't even tell you how many times a kid has crossed off yes. And they haven't told a parent, they haven't told a teacher, they haven't told a school counselor. I've had kids tell me, well, last month I actually overdosed on Tylenol or allergy meds and it didn't work. So some of these kids have already attempted to kill themselves and are just suffering in silence with nobody knowing. So how can I not step in and help in this epidemic?
I love that you are open, with sharing something like this, because I don't know why, but I feel like pediatricians are in a great position to help, right? Especially when you're seeing these children annually at these well child visits. Heather, what do you think the future of pediatrics looks like? In particular, what problem do you hope gets solved within the pediatrics sector in the next 5 years?
I don't think it'll happen, but I think the pediatric mental health issue has to be solved. I mean, we're talking 15%, somewhere around there, of kids have a diagnosable mental health issue, and they need access to care, and it's just not there. So I think that's something that we have to deal with. There's also a significant problem with toxic stress, which Nadine Burke-Harris really speaks about very eloquently, where kids are facing issues with incarcerated parents, addicted parents, poverty, abuse. A lot of kids are really suffering, and that causes lifelong issues. And that's something that our society has to deal with. And the opioid crisis has just made that worse. I mean, the foster care system is exploding because of the opioid crisis right now. So there's actually a lot of issues that pediatrics is facing that are major issues, and I think it's going to take longer than 5 years, unfortunately.
You mentioned that the pediatric field grows and expands and that there is ample opportunity for lifelong learning. What did you mean by that? Because I feel like some of the pediatricians, and it's not just pediatricians, I feel like some providers in general are feeling a little stuck.
Well, I think it's easy to stay in a rut. You go through residency, you learn a certain set of skills, and I think many people just go through their career just using those certain sets of skills, and they don't expand beyond that and teach themselves new fields. I like to push myself and learn new things. I love to keep learning. If I was in a job where I didn't keep learning all the time, I would get bored very quickly. So one thing that I learned on my own was I learned about prescribing birth control pills partly in residency, and then taught myself further details and refinements on my own. And then I thought it would be great. So my practice is in a small, somewhat suburban/rural town, and people don't like to drive to the bigger city sometimes for further care or to see specialists. And there's a big barrier for young girls to see a gynecologist. I think there's a lot of fear about that. What might happen? What are they going to ask me to do? And then if they see a gynecologist, maybe their dad would find out and ask why. There's just a whole lot of barriers to seeing a gynecologist. So I thought if I provided other methods of birth control in the office so kids didn't have to travel, that would be really helpful for the community. So I talked to some other providers who provided Depo-Provera, which is an injection that lasts 3 months and is a form of birth control. So just recently, in the past 3 or 4 months, we've started providing that in the office, and it's actually really taken off. So it's become a very popular option for the young women that I work with. And the SSRI prescribing for anxiety and depression, I did some work in residency on that, but then taught myself more on my own. I look forward to, in the future, probably managing genetic testing results. There's already direct-to-consumer genetic testing. Certainly for autism, it's pretty prescribed at this point what genetic tests are standardly recommended. I would need a lot more training and counseling people after these results come back. But I think in the future, people are going to be testing their genes for things. People are going to be testing their microbiome. There's just going to be a lot more information that people have about their bodies. So I think that's going to be part of the future, and I'm looking forward to that. I think it's going to be an exciting time. So I look forward to learning new avenues. But I've seen other pediatricians that I trained with who just kind of closed the doors and said, I don't know about that. I'm not going to offer it.
Well, Dr. Morreale, this has been an absolute pleasure. Thank you for being a part of PedChat.